It's time for our Healthy Families with Omni Family Health series. Today's topic is all about women's health services. We have nurse practitioner Justina Adangai here with more. Thanks for joining us again today.
Thank you for having me.
So let's start, I guess, from the beginning. At what age should a girl or young woman start seeing someone for their services?
So a girl should start seeing women's health, whether primary care or gynecology, about the age of 13 to 15, or when they become adolescents, or when they start engaging in sexual intercourse, whichever one comes first. This visit usually talks about puberty, menstruation, and just general health.
And then, so after that, how often should we be going back to this women's health services?
Ideally, a woman should have a yearly wellness check. However, depending on age or other medical conditions going on, we can have more frequent visits.
And so what are some of the tests or screenings that we're looking out for when we go to these visits?
At this visit, you would typically would see like a comprehensive exam, pelvic exams, breast exams as well. We also would have some screenings going on, such as maybe the cervical cancer screening. That's the pap smear that you hear about. We have the mammogram to check for breast cancer as well. We check for sexually transmitted infections, chlamydia, gonorrhea, you name them all, and just general, reproductive health and just wellness in general.
Well, and especially with like the breast cancer screenings, we should be seeing an OBGYN throughout our entire lives, not just if we're trying to be pregnant.
Absolutely, that is very important. You see people at different ages having, breast cancer or even cervical cancer, young children. It could be family history, it could be environmental. So definitely a screening every year is very, very encouraged.
When it seems like a lot of us put off doctor visits until it's like the very last moment or we really, really need help, but
Yes.
screenings are really important to make sure we don't get there, right?
Yes, early detection is key, as you would know. The earlier something is being caught, the better. So we always encourage, just get screened. If it's negative, you just move on with your life. If it's positive, then something can be done about it on time.
And then is there any type of age cap, or like if you hit menopause, do you not have to worry about seeing an OBGYN as much?
Oh, I think that's even the more reason why you should. We have had patients, menopause symptoms can be very bad and very discomforting to a lot of people. So there is no age limit. I would say women can see OBGYN till the end of their life. It could be, just sexual education, sexual health, reproductive education, just to make sure that your wellness, health-wise in general, and reproductive health is up to par.
And can you walk us through some of the women's health services at Omni?
So good thing about Omni is we have a wide range of providers, family practice, internal medicine, gynecologists, OBGYNs as well. So we see anything from pregnant women, childbirth, cervical cancer screening. We order for mammogram screening as well. Basically everything reproductive health, reproductive disorders, we are able at Omni to address all of those and get people screened early and also have intervention done on time.
Great. Well, thank you for all this information. What's the best way to reach out?
The best way to reach out to us is our 800 number, or you can go to omnifamilyhealth.org. And now we even have texting options where you can text in and get an appointment made.
Awesome. That's so convenient. Well,
Absolutely.
Thank you.
Yes, thank you.
We'll be right back after the break.